Today's topic, prevention. I'm going to speed things up a bit, but I'm going to try to identify some of the things that are special in cancer in regards to dietary advice, and basically in cancer you have, as in many other diseases, you have a prevention stage, and then during treatment, and you have a palliative phase. I'm going to look slightly on the differences and a little on the attitude among oncologists to dietary advice and how to give. This is a schedule I did which shows how the patients are diagnosed, then hopefully they receive a curative treatment and are cured. This is what we hope for all of our patients, and luckily today it's more than half at least that are cured, and we're hoping it to be more in the future. And if not, if you're not able to cure, you go into a palliative phase. You get palliative chemotherapy and radiotherapy, and when this isn't feasible anymore, you go into a phase of best supportive care until death. And I've divided diet, the goals of diet and dietary advice, into 4 different categories. What you hope to affect by advising the patient on diet. You have prevention. You can advise certain diet for symptom relief and caloric adequacy, that you don't want the patients to lose too much weight, and affecting progression. And sometimes these goals can conflict each other, which I think sometimes causes confusion among patients and healthcare givers. And the prevention is here, and the rest of the goals, of course, are below. Very quickly, on a few data on the role of diet in cancer. There's this quote is often heard everywhere, that according to the World Health Organization, 1/3 of all cancers are preventable. And to anyone who's interested in preventive medicine, it sounds like a low number. If you ask, I often get the question, how much of cancer is related to diet? And I usually say 1/3. Then it's a number that's been like a standard number since the 80s. This is a later review by Walter Willett, and this is mainly in the US. It's probably a number you can apply to Sweden and the rest of the Western world, at least. We often think of the American diet as the absolute worst, but the fact is the Swedish diet isn't very, very different, and not in many other European countries either. This landmark study by Anand is definitely worth checking out. They did like an estimate on not only diet, but all factors that might lead to cancer, and the conclusion is that only 5 to 10% of all cancers are directly caused by genetics, and that the rest is from environmental causes. This is a larger number than this 1/3 from the World Health Organization, but I usually think of this as the theoretical. How much cancer can you prevent theoretically? And the World Health Organization is how much can you prevent practically? You can't practically get everything here down to 0. This was a study I hope someone else might talk about today. A study from Oxford which connects to the question on the vegan diet. Is the vegan diet really better? This isn't only cancer, it's an analysis on how many preventable deaths there are from different kinds of diet, from following global dietary advice to a vegetarian diet and a vegan diet. This is, of course, healthy vegetarian and vegan diets, not centered around soy ice cream and etc. And you see it gets higher, and this indicates that there are further benefits to completely reducing animal products rather than just diminishing. The World Health Organization was also mentioned by Professor Leitzman in German, that they're on the website Diet and Cancer Report, they have this incredible review where they used 500,000 studies, included 7,000 in the end, and did a gigantic meta-analysis on everything that has to do with diet and cancer. These are different diet forms, cancer forms. These are different kind of dietary components, and you can see that it's a lot of green. That means it's something that decreases risk of cancer, and the greener it is, the more evidence you have. And these are all different kind of fruits and vegetables and nutrients that are found in fruits and vegetables. And you see a red line here, that's the red meat and processed meat. So the general advice is eat mostly foods of plant origin. There are totally 8 or 9 advices, I think, recommendations, I think. One applies specifically to meat. We should eat less meat and no processed meat. When we're thinking about these different stages of cancer, an important thing to note is that these recommendations from the World Cancer Organization isn't just for prevention. They recommend that cancer survival for reducing risk for recurrence should follow the same recommendation, plant foods. Newsflash, when we're talking about World Cancer Research Fund, they have yesterday just updated one of their reports on stomach cancer, and it was good news for everyone who's enthusiastic about diet. They strengthened some of the evidence, especially processed meat here has strong evidence for increasing risk of stomach cancer, and this also was added that grilled and barbecued meat and fish has a limited suggestive evidence for increasing risk. Meat causes cancer is, we talked also, Dr. Leisman, about the difference between causation and connections. When it comes to meat, we can actually say today that there is a causation due to all these gigantic amount of data. And it's not new data either. The first time this was indicated was here. It's a reference from the New York Times where they write about a study where it's from 1907. And and almost every year since then, different reports have come to strengthen this evidence. Still, many are surprised today, or at least 5 years ago, maybe less today, when you say that meat causes cancer. I've never heard that. But yes, you heard it last year and the year before that, back until 1907. Also, the World Health Organization has had 6 months ago this press release on their views. After a literature review, they classed processed meat as a class 1 carcinogen, same as cigarettes and asbestosis. Quick look at why, though. The mechanisms that have been that are potentially are these fives, basically heme iron in the meat, the nitrosamines, fat peroxidation, and when you cook at high temperature, hydrocyclic amines and polycyclic aromatic hydrocarbons. Very long words. But I raise this because sometimes you get the question that organic meat, that doesn't cause cancer, does it? Well, what's the difference? Would the hormones, would the antibiotics, or would the pesticides cause cancer? Well, they could, theoretically, not the antibiotics. They can give you multi-resistant infections. But we don't have data that says for sure that this even causes cancer from meat. And if it did, as is shown by this Spanish study, the difference in pesticides between organic meat and non-organic is virtually nil. In fact, they had more pesticides in lamb. Yes, I think I'm going to skip this. This is about vegetables, basically the same thing. But the important thing is to eat green, and the additional effect of choosing organic is quite small. I think I'm going to skip this also. Supplements is often a question. Is it good for cancer patients to eat supplements? Well, a study that we can lift in this context is the CARROT study, which 20 years ago showed that if you give smokers beta-carotene and retinol with the hope of reducing the risk for lung cancer and cardiovascular disease, the reverse happens. It actually increases. This is the ones. Another important question in oncology is this. You know that cancer treatment, both radiotherapy and chemotherapy, depends on oxidative stress through free radicals. And so there's been a theory that if you take antioxidants, you get less effective treatment. So there's been a debate about this since long. And here's a review from 1999 where basically they show that considerable data shows increased effectiveness of many cancer therapeutic agents. This is, however, mostly in vitro studies. There are some interactions. For example, tamoxifen has been shown to be inhibited by a phytochemical called tangeratin, also later by genistein, which has caused a confusion in the oncology community. Genistein is one of these phytoestrogens that you find in soy, and this has led to some oncologists, at least 10, 20 years back, to tell patients not to eat soy. There are less and less oncologists that say this, because the evidence have shown the reverse. The more soy you eat, the less risk of breast cancer and also less risk of recurrent disease. I think I have to, this is basically the same thing. No consensus has been reached on antioxidants in pill forms, and more study is needed. These are just 3 randomized trials that I've done in one review from 2013. Can we affect progression with the progression of cancer? Can it be affected? This was hinted by this landmark study. How many? It's a man called Dean Ornish who published this study in 2005. How many in here have seen this study before or heard of it? Raise your hand. Yeah, it's a very enlightened crowd. This was a study where people who were supposed to get, had a low-grade prostate cancer, who didn't require treatment, were followed for 1 year, and half of them were randomized to plant-based diet, and their PSA dropped during this time. The others had a rise in PSA, and the numbers needed curative treatment was 6 in the control arm and not a single one in the intervention arm. They also took blood works which showed that if you drop their blood on cancer cells, you see after 1 year that the growth of cancer in the patients who have eaten a plant-based diet and moderate exercise are seven times greater. And this effect is greater the more adherence you have to these advices. There was just 1 year ago on ASCO, one of the big conferences of oncology. This study was, sorry, I think the batteries are going. It's a study on a prostate cancer patient with low-grade disease where they give a supplement. There are 2 kinds of supplements. You can have supplements with isolated nutrients, and there's also these kind of supplements with basically dried concentrated fruit. Intuitively, these latter should be more effective since they're basically food in concentrated form. And this was one of these. It was pomegranate, green tea, broccoli, and turmeric in a pill form, and it had effect. It was a randomized, double-blind controlled trial, and the PSA rise was 80% in the control group and only 18% in the other one. I have 1 minute left, and a lot to say. I was going to go through these dietary advice after cancer diagnosis. I had some more slides, but I think I will settle to say that they basically all say the same as World Cancer Research Fund. Plant foods, no supplements, and I'm going to stop with a reflection on the obstacles we have to give dietary advice, both in oncology. If you ask physicians, they generally say lack of time, lack of knowledge and tools. But there is also this notion that a healthy diet is equal to a lower quality of life. I'm sure you've heard this from colleagues, that why should I tell the patient to stop eating meat? I know how much he loves eating meat. Fear of blaming the patient, and this is a especially important question in oncology, where there's usually a lot of feelings towards this. So how do we overcome these obstacles? Well, we can ask for more time. We can consult the guidelines. We have this in my clinic, just a small card that we give patients. And these 3, I think, are interconnected. If the fear of blaming the patient is mostly, in my experience, related to the caregiver attitude towards diet, towards obese patients, and unhealthy lifestyle. And if you have a prejudiced view of, maybe a condemning view of unhealthy lifestyle, you will blame the patient. So the answer to this is just don't blame the patient, neither in thought, mind, speech, or action. And use introspection and change attitude. The fear of patient over-reliance on diet is a problem that also you can discuss in length. Actually, when I was preparing this talk, I received an invite on Facebook to a patient that was going to talk on how she abandoned her oncology treatment to use diet instead. And this, I think, is a reason for a clash between the oncology community and the furthering of diet and lifestyle advice. I think you need to find some kind of, how should I put it? You need to be well, patient and open-minded, and have an attitude of calming colleagues that are worried about this. It's a very rare phenomenon that patients decline their active treatment because they want to try diet instead. But when it happens, basically every oncologist have been confronted with this, and it's something that makes oncologists more reluctant to giving dietary advice.
Thank you very much, David Stenholtz. We have to move on, unfortunately, but thank you
very
much for your insights.